Good evening, and thank you so much, Ellen, for that introduction. And thank you for inviting me back to speak on behalf of the Holy Family Hospital. I'm honored as the hospital holds special significance for me as a member of the order and also, as Ellen mentioned, a neonatologist. Since 2014, I've had the privilege of going to Bethlehem as one of a number of doctors from abroad who volunteer their time teaching as visiting professors. I traveled there most recently right before the pandemic in January of 2020. Each visit has drawn me closer to the vocation and spirituality of our order. Last year, to illustrate for you the work of the Holy Family, I shared the story of one of the women our hospital has helped, Hadil, and her baby Jude, one of the smallest newborns to be saved at the Holy Family. Hadil had arrived at the doors of the Holy Family only 24 weeks pregnant and in labor. She had traveled a mere 9 miles from her village, a journey that, without a car, took her almost 2 hours. She'd been turned away from the government hospital because for them, a 24-week baby is essentially a miscarriage. She was alone, tired, and scared when she arrived at the Holy Family looking for hope. At Holy Family, Jude was born at 520 grams, lighter than a bottle of water. Had he been born elsewhere, he'd have never made it out of the delivery room. At Holy Family, he was taken to the NICU where doctors and nurses specialized in caring for the smallest of lives, took care of him. A ventilator helped him breathe. An incubator kept him warm while he grew. He received special nutrition by IV until his intestines were mature enough for milk, and then fed by tube until he could feed by mouth. He got x-rays and ultrasounds, blood tests, and antibiotics. Had he been born elsewhere, he'd have had few or none of these, and not a chance at survival. Today, thanks to the Holy Family, they are a healthy and happy family. Women like Hadil arrive at the Holy Family every day, carrying the hope that new life brings, and searching for hope in difficult circumstances. They come because other hospitals are unclean or unsafe. They come because they are turned away elsewhere because they cannot pay. Or they come because, like Hadil, they are told by other hospitals that they are unable to save babies so premature. For them, the Holy Family is a place of hope. It's that specific theme of hope that I want to focus on tonight. That story of Hadil and Jude took place before a global pandemic took us all by surprise. And as businesses closed and jobs were lost, family members took ill and were lost, hope became something people the world over, especially in places like Bethlehem, came to need more than ever. Through this past year and a half, the Holy Family has continued to provide hope for the people of Bethlehem in even more ways than before. Take, for example, baby Khalid, who my neonatologist colleagues at Holy Family recently told me about. Khalid was born at the Holy Family this past spring at 29 weeks to a mother who was ill with COVID. Her family chose the Holy Family because they knew that there would be their best hope, both for her health and for that of her premature baby. Because of her worsening condition, doctors at the Holy Family decided they needed to do an urgent C-section. Khalid was born and taken to the NICU, where, like baby Jude, he received respiratory support, warmth, antibiotics, and nutrition, while he grew to be able to breathe and eat on his own. In the meantime, his parents couldn't visit him because of the isolation protocols we had in place for babies born to COVID-positive mothers. But they had placed their hope and their trust in the skilled hands of our doctors and nurses, and in the reputation of the Holy Family in taking care of babies such as Khalid, the hope that brought them to the doors of our hospital in the first place. For his first 14 days, including his most critical, they watched him via FaceTime until they could finally hold that precious life they had hoped for in their arms. And this is them today. This is the work of the Holy Family, providing hope by saving vulnerable lives in a region where they might otherwise be given up for lost, caring for women who have nowhere else to turn, even more so now. The economic situation in Bethlehem has always been difficult, and this has only been made worse by the pandemic. A city that depended on pilgrims is now deserted, the economy devastated, most are unemployed, and many families are left without a livelihood. Financial instability has delayed marriages. As a result, the birth rate has dipped, but our NICU remains busy, with over 400 babies admitted since the pandemic started. The infants we've seen during the pandemic are born smaller and consequently sicker, not just because of their age, but because too often expectant mothers give their food to their other children before they themselves will eat. As a result, mortality has increased, even at our hospital, where it's now 2.6 per thousand, up almost a point from where it was before the pandemic, but still two-thirds lower than the national average in Palestine. Through it all, the Holy Family's state-of-the-art NICU continues to be the only place in the region where premature babies as young as 24 weeks are able to receive the intensive care they need to survive, care that is comparable to that given in the United States. At other hospitals in the region, mothers are simply turned away if they're in labor at extreme prematurity. Their baby is considered miscarriages. The hospital has also been hard at work meeting the increased needs of mothers as well. Some of the mothers who have come to us have been so sick with COVID, they've needed to be placed on ventilators, something that isn't normally done on a maternity ward. Until recently, our only ventilator outside of the operating rooms was from 2006. Thanks to generous donors like you, we now have 2 new ventilators available for use for when that need arises again. Another difficulty is that mothers are now even less likely to seek prenatal care. So our outreach vans are busier than ever, working to reach them where they are, even picking them up to come to the hospital when needed. I've mentioned how maternal nutrition has suffered during this pandemic. Thanks to donations, we've been able to supply mothers with free prenatal vitamins when they start their care with us. And despite all the hardships, our maternal mortality rate remains extremely low. Not a single mother has died at Holy Family since 2012. Even with all the hardship in Bethlehem, our hospital continues to provide hope by sharing with people in need in more ways than just strictly medical. Our nurses, noticing that mothers were taking fruit from their meal trays to feed their children at home, put the call out to the community to help. As a result, every day, people from the area bring baskets of apricots and persimmons to share with mothers. Our hospital's oxygen plant, despite being designed to run only 8 hours a day, now runs 24 hours a day, providing medical oxygen to all the other hospitals in Bethlehem at no cost to them, but at significant financial and manpower cost to us. Lastly, our hospital continues to provide the hope of a future for Christians in the Holy Land. Christians now are a small and dwindling presence in Bethlehem. Many have higher levels of education and opportunities to go abroad, like my colleagues there who trained in Europe and the US. The collapse of the local economy during this pandemic leaves little incentive for many to stay. Our hospital provides 191 direct or indirect jobs with pensions and paid time off, helping to provide a livelihood to Christian families, helping maintain that Christian presence in the place where Christ was born. Whenever I visit the NICU at Holy Family, its 18 beds are always full, half of the babies usually on some sort of respiratory support. Most are not Christian, which brings to mind the words of late Cardinal Hickey, that we help the needy not because they are Catholic, but because we are Catholic. Regardless of their faith, all the mothers that deliver there are proud to go home with their babies wrapped in a blanket and wearing a knit hat, both emblazoned with the cross of our order. It is a point of pride because by showing they delivered at the Holy Family, they are saying they gave their baby the best. At Holy Family, where Christians and Muslims work side by side, taking care of patients of both faiths, interreligious harmony is nurtured. The hospital is a shining example of people of different faiths living in peace and mutual respect. It is also a beacon from which the Catholic ethos of respect for life is spread throughout the region. As of now, some 70 pediatricians and OBGYNs who have received their training at the Holy Family have carried that ethos to their communities throughout the country. Serving life, especially the most vulnerable, is at the core of our shared vocation as hospitalers and as Christians. Some of us have the privilege of living that vocation through our professions in medicine or nursing. But the body is many parts, and no matter our part, all of us are called to live that hospitaler vocation, spiritually, materially, and through our own talents and skills. That the body is many parts is true for the Church and the Order, and it is especially true for how we care for the smallest at the Holy Family. Care of the micropreemie involves not just doctors and nurses, but also nutritionists, pharmacists, social workers, and numerous other support staff working as one body. It requires high-tech equipment, expensive supplies, medications, clean floors, well-fed staff, working computers, adequate facilities, ambulances, and many more material needs. Without the donations that support all these many parts, the hands, the doctors and nurses would be unable to carry out their healing vocation. Without all the parts working together, these mothers would be left, like our Blessed Mother, knocking at doors, unable to welcome them. Most in the district are now unemployed. More than 100,000 women live in refugee camps, and there is no social welfare or health insurance to speak of. Many more women now cannot pay for care or even to travel. As a result, even more give birth in less than adequate conditions. The Holy Family continues to offer them a place to turn. With a greater number of charity cases and need for more and more costlier supplies during this pandemic, financial help is needed more than ever for equipment, to keep paying salaries, and to ensure that the families that have no income, nearly all of them now, are taken care of through our Poor Case Fund. Your support will help the hospital continue its mission through this crisis and beyond, opening its doors to families like the original Holy Family 2,000 years ago, turned away everywhere else and in desperate search for hospitality. Your donations ensure that our 8-pointed cross continues to be a symbol of hope amidst hardship, and your support helps us save lives that might otherwise be lost. And lastly, your support helps promote peace among peoples in a place where the Prince of Peace was born. Thank you.